Good morning, everyone. Welcome to Webinar Wednesdays. My name is Maria Maddox, and I will be one of your moderators today. We are pleased to have Hedda, Meadan, and Jamie Pearson give us a session on using evidence-based strategies to support social communication skills of young children. Hedda is an associate professor at the Department of Special Education at U of I, and Jamie Pearson is a doctoral candidate in the Department of Special Education. They will give you a little bit more information about themselves in a few minutes, but I do want to kind of just let you know who we have speaking today. As usual, we have myself as a moderator. You'll also hear from Mickey Ostrowski, who is also part of the U of I and as the head of the department and a Gold Stick Family Scholar in special education. Alyssa Jones might be joining us as a moderator as well. You'll hear her maybe. So if you have participated in this before, just kind of sit back and listen. If not, this will be news to you. So the webinar today will give you EI credit hours as well as state licensure credit hours in the disciplines listed below. And once you have completed the webinar, you should get a unique email to your name that you registered under, and it will be from the EI training program. In that email, there will be a certificate, a survey that you will need to complete. And once you complete that survey, you will get a certificate of completion in 24 hours. So if you have joined as a group, you will each need to have registered individually and to get that email and to be able to get credit for participating. Webinars are fun because we all get to kind of sit where we are and look and participate without having to travel anywhere. But you are looking at a computer. So one of the nice things about webinars is that we do have a lot of ways that you can participate. We really encourage you to participate. We want you to participate. So a couple of ways that you can do that, first off, is through using the chat. Down on the bottom of left side of your screen, you should see a box that says chat. Many of you are using it right now as I see that. You can use the chat box here to type in questions that you may have as the presenters share their information. Use it to share strategies or comments about what is being said. This is a great way to stay engaged in the conversation. We will be having question breaks, a couple of them throughout the presentation. So as you think of a question, please just type it in, and when it comes close to the question break, we will gather those questions that have been typed in and we will present them at that point in time. So don't wait. Don't wait till that break to type your question. Go ahead and type it as you think about it. Also, you can detach it if you use those little bars off to the edge of that box and make the chat box bigger or smaller so that you can see more of the chat or less of the chat, however you would like to do that. A couple other ways that we might ask you to participate. If you look under your name, you should see 4 boxes. And these 4 boxes, a couple of them we will use. The first box is an emoticon. So if you hear something that Hedda or Jamie says and you want to applaud it, you can click the emoticon and choose that, or an LOL, or however you want to express your emotions. We don't really use the second box, but the third box is a hand raise. So if Hedda or Jamie just has a question, they say, just by show of hands, let me know how many of you, whatever, you can click and raise your hand. Okay. The fourth box is a polling function, which we will use a few times. And in this polling function, you will be asked a question, given a choice, a multiple choice of options, and you will be asked to select the responding answer. So as you see, I do have a poll here. We want to see who all is participating. So if you will click that fourth box, it should have a letter A in it, and let us know who all is in the room today with us. We really encourage each and every one of you to do this so that we can really get a good feel of who's present. Imagine just being in a face-to-face room where the presenter is asking by a show of hands. It really does help the presenters know who they are engaging today. So we'll give folks a few more minutes to do that. And let's see here. All right. Ladies, it looks like we have a strong majority of early interventionists participating today, some CFC staff, some other, and if you are an other, please list that in your chat box so we can kind of see what are the others that we're looking at. We do have another poll that is going to be coming up next, and that is, if you are an early interventionist, please indicate what type of early interventionist. And again, if you are an other, identify that in the chat box. Give folks a few minutes to do that. Researcher, yes. Thank you. All right, give folks another few seconds. Okay. Well, it appears that we have several developmental therapists and speech-language pathologists, a few PTs, and others. So we see DT in there. Okay. Family support specialist. Thank you, Sherry. All right. Okay. So now you all kind of know how to use the polling function. Thank you for responding. And we will be using them a few more times throughout the session. So with that being said, I am going to turn this over to Hedda and Jamie, and they will tell us all about communication.
Good morning, everyone. Thank you for joining us. This is kind of the agenda of what we are hoping to talk about today. We'll talk about who we are. We'll talk about the objective of the webinar. We're going to explain why social communication skills are so important and a few strategies that we can use to enhance social communication skills. This will be kind of, most of the time we're going to spend about the naturalistic strategies. And we're also going to talk about parents and how we can coach parents and encourage them to use these strategies so we can encourage and create more opportunity for the kids to communicate. We hope that you're going to ask questions and we're going to go over the materials, but hope we can have some discussion among all of us. So we'll start with telling you a little bit about ourselves. So this is a picture that both Jamie and I really enjoy sharing with you, especially on this cold day. We just came from Hawaii a few weeks ago. We had a conference where we presented research projects related to the material we're going to discuss today. I'm on the left, telling you a little bit about myself. I used to be a preschool teacher for young kids with disabilities, and I was always interested in social communication skills and challenging behavior, and I truly believe that in order to understand a child and help a child, we need to look at the family as a unit and really talk and communicate and collaborate with parents and other family members. So this is how I kind of got involved with family coaching and this topic. I'm also a mother of 4 boys, which make me very busy, but also have a lot of experience and many examples about challenging behavior and social communication deficits. So I'm kind of experienced this as a professional, as a mom. So that's me. And now Jamie.
Good morning, everyone. I'm Jamie, and I'm on the right in our picture in Hawaii. So before coming to the University of Illinois, I worked in North Carolina in home-based programs as a behavioral therapist for children with autism, primarily young children. And I'm just really interested in supporting families, particularly families from racial and ethnic minority backgrounds, and helping families gain access to services for their children. So I'm really excited to be a part of this webinar today.
Okay, so the objective for today, talking again on social communication challenges with young kids, evidence-based naturalistic strategy. These are most of the time we're going to spend on that, collaborating with families and training and coaching families.
So when we think about social communication skills and working with young children, it's important to remember that these skills we're referring to lots of different skills that children might use when using language to communicate and to engage in conversation. We're also thinking about young children who might have autism or other developmental disabilities, and in these cases they often exhibit deficits in their social communication skills. And it's important during these early childhood years that as adults that we're responsive and able to facilitate the development of these children's communication skills. So these are kind of the foundation in thinking about and understanding the importance of developing social communication.
A naturalistic teaching strategy is a collection of strategies that are based on behavioral principles. They are designed to encourage specific behavior. In the case we're going to talk about the social communication skills. And they are used in natural environments, typical setting, activities, and that's why they're so appropriate for using with young kids with disability. When we talk about naturalistic teaching strategy, we call them evidence-based strategy, and we kind of want to clarify what do we mean by evidence-based strategy. So people use different terms: evidence-based strategy, evidence-based practices. DEC, the Division of Early Childhood, calls them recommended practices. And how do people come up with this idea, what's included as evidence-based practice and what's not, is based on first clinical experience of many years saying some strategy or intervention or practices are very effective, with research that are done with rigorous research design to demonstrate that there are effective results for using the intervention. So in order to be included or kind of called evidence-based practice or strategy, we need to have many research projects that all come up with the same result, that the intervention is effective. We know that naturalistic teaching strategy are effective in addressing social communication, behavior, play, and academic skills, which means there are many, many studies that look at this specific topic and found them effective for young kids up to age 11. So we're going to discuss today the evidence-based practice, which are naturalistic teaching strategy. We don't expect you to be able to read what is here, but this is a document from 2014 by Wang et al. That identified, they review all the research related to young kids with autism, actually all ages of kids with autism, look how if there are enough studies that demonstrate effectiveness of specific intervention. And they identify both modeling, naturalistic intervention, and also you can see parents implement an intervention as evidence-based practices. So the discussion we're going to talk about today is about these evidence-based practices. We have the clinical experience, we have the research to support those strategies, and now we just need to make sure that we implement them in the right way to make sure the kids and the family benefit from them. So the fourth strategy we're going to talk about, before I even talk about this fourth strategy, I want to kind of highlight where we all this coming from. So the IPIC program is what, sorry for the not straight line, I'm sorry, I practiced in work. So the IPICS program is the internet-based parent-implemented communication strategy. It's a project that both Jamie and I work on, and we kind of use this strategy and develop parent-friendly materials to use with them. So the strategy and the materials we're going to show you today are based on that project. So the first strategy is environmental arrangement. Again, we're going to talk about each one of these very specifically and the steps to be implementing them in a second. The second one is modeling. Then we're going to talk about command model, and we're going to talk about time delays. So these are kind of the four strategies that we're going to discuss. We want to mention that environmental arrangement is the one that we expect people to use with all the other three strategies that we're going to discuss today. So it's kind of in combination with the other strategies.
So before we move into each specific strategy, we'd like to take a minute just to ask you a question. So what do you guys think? Which action is most likely to encourage communication? Is it A, making sure the child gets enough playtime outside, B, eating breakfast with the child, C, using baby talk to make language easier for the child, or D, withholding preferred objects from a child?
So at this time, make sure you go to your polling function, that fourth box on the under your name, and indicate your answer. We will give folks a few seconds to respond, and we do encourage each of you to indicate a response here. Okay, give folks a few seconds. Okay, I see more responses coming in. Good. All right, let's see what we got here. Looks like, we move that around and make it bigger. Looks like most folks responded with the answer D, with B being the second choice. So, ladies?
Great. So it looks like most people chose D, which is correct. And we want to highlight here that withholding preferred objects until the child asks for them is most likely to encourage communication, but having time to communicate while eating breakfast, for example, is also another way to be able to communicate effectively. But in this case, we're really focusing on those opportunities that are most likely to encourage communication. So in this case, D is the correct answer. So nice job.
So there's no, we want to make clear, it's not right or wrong answer.
Right.
This is the kind of the answer we were hoping for, because that's the one kind of leading, or that's the transition to the next slide. That the next slide, we're going to talk about the first strategy, which is environmental arrangement. And we know that all of you are probably using environmental arrangement. So environmental arrangement, the purpose is to setting up opportunity for the child to communicate. And it's best used with other naturalistic strategies. So from now on, every time we're going to talk about other strategy, we can kind of remind you and say, well, just remember that use environmental arrangement to create the environment that will enhance or provide more opportunity for communication. So environmental arrangement could sound very big, and when we talk with parents specifically, sometimes they feel very lost. And what do you mean by arranging the environment? How can we make it more clear to them? So we came up with the idea of looking at 3 types of things we can do as adults with the parents or service provider or anyone else. We call them the pick, the present, and play. And of course, we start with the motivation. We use a favorite or novel items for activity. And then we pick something that will motivate the child to communicate. We present it in a way that will promote communication, and we play with it in a way that will encourage the child to communicate. What we're going to share with you now is a handout that we actually use with parents. So if you notice, you're going to see it says your child, so which means it was developed for parents, but of course we can change that and adapt that for different people. So going back, we said pick, present, and play. So for pick, we pick something that really the child really likes. So we can pick an activity or game that needs to have 2 players, playing with balls, or something else that have 2 players at least needs to play with. So the child will have to communicate with you in order to play with it. We can also pick a play that the child really, really likes. Favorite Legos or books or even food that the child really likes, and create some opportunity for the child to communicate, because he or she are very motivating to communicate with you. This is the pick, so just a few examples. Then we present. So presenting, again, is how do we arrange mainly the physical environment in this case in a way that will promote or encourage the child to communicate. So first we can present the child, that the child can see something but cannot reach that. In that case, the child will have to request something in order to get what he wants. So putting a toy on a shelf that's high that the child cannot reach, for example. Another thing we can do it with toys, objects, or even with food. We can put the item within a clear container that's hard to open. So the child is very motivated to get the item or the food or whatever it is in the container, he or she has to ask you for help in order to open that. So this is kind of the present piece. And the next one is the play. So we pick something the child really, really wants. We present it in a way that encourages the child to communicate or request something. And then we play with it, because of course it's all about fun and having fun with the kids, and within the natural environment and the play activity create more opportunities. So we can have a spin or a top and play with it, you know, and then when it stops playing or stops moving, we just wait for the child to initiate and ask for more playing. Another thing is with bubble. We can blow some bubbles. We know the child likes it. He can play with them. He can pop them. He can do whatever he wants, or she. And then when it's done, we just close the bottle and wait for the child to initiate. So we know that there are many, many different environmental arrangement strategy, but in order to make it kind of clear and easy for people to remember what activity we can do, we just call it pick, present, and play. And this is, again, it's a handout that we just share with parents.
So we'd like to do another polling question to find out which is the best example of teaching communication skills. Do you think it's A, when the child is playing with a favorite toy, the parent smiles and says or signs, "Good job"? Is it B, the parent places a favorite toy out of reach? When the child looks up at the toy but does not request it, the parent says or signs, "Toy"? C, when the parent realizes that the child wants a toy but the child does not ask, so the parent gives the child a toy and says, "Here you go"? Or is it D, the parent gives the child a high five when the child follows directions?
So go back to that polling function, that fourth box under your name, and we'll give folks an opportunity to respond to that answer. Please, all of you, if you can, respond. That would be awesome. Give folks a few more seconds here. We're getting quite a few responses. That's good. Okay. Well, by far, it looks like pretty much everyone answered B. So, ladies, what do you think?
Awesome. So, again, there's no perfect answer necessarily, but in this case, the parent placing a favorite toy out of reach and then modeling for the child how to say or sign toy when the child doesn't request it initially is the best example of teaching communication skills.
Yeah, and there's a question. Nikki asked a question, and we can respond to it now. Nikki asked, how do you balance pushing a child to initiate and not making the child frustrated? And this is a great question. Mm-hmm. And I don't think there's a kind of a one answer to that. It's very individualized.
Right.
You need to know the child that you're working with, and you know how much you can push, because a child who's frustrated and experiences a lot of negative outcomes because he doesn't get what he wants will get frustrated and might shut down and stop communicating with you. So you really need to kind of look at the child and see where the child is. Is he still motivated to get the items or activity? Is he still engaged with you, or he already left and moved to a different activity? So we always talk about balance between creating opportunity, using teaching moments, and also having fun. We always have to remember that we have to have a positive interaction with the kids and always kind of think about the balance between teaching and having fun. So there's no one answer for that, but that's kind of what we are thinking about when we read your answer. Yes.
So this leads us into our next strategy, which is modeling. And so when we think about modeling, we are thinking about, so modeling is essentially a simple strategy where we use demonstrations to teach the child new words. And we really want to focus here on the importance of teaching new words, phrases, or signs, or behaviors that you want the child to imitate while you're doing activities that he or she really enjoys. So as Hedda just mentioned, participating in activities that the child really enjoys and finds motivating is very important when working on these strategies. So the first step there are different steps for implementing a modeling procedure, and the first step is to establish joint attention. So you establish this joint attention by focusing your child's attention on a specific object or interest, and then you and the child that you're working with need to be paying attention to the same thing. So if the child's looking at the item or at you, that's a very good sign that you've established joint attention. So that's the first important step in modeling. Secondly, you want to model what the child should say or do. So if you want the child to ask for more or request more, then you will model that, and then you will wait 2 seconds for the child to respond.
And the time, we put 2 and 3 seconds. It's going back to the idea of balancing. We want to make sure the child is still engaged, but we want to make sure also that we give the child an opportunity to imitate the modeling. So it's kind of, the 2 and 3 seconds is kind of an average. You really need to decide what's the best time for the kids you're working with.
So if the child responds correctly, then you want to verbally acknowledge the response and give them lots of positive feedback and verbal praise. If, for example, they use the wrong or respond incorrectly, then you go back, you make sure you've established joint attention, and then you go back through each of your steps. So modeling what the child should say or do, and then wait 2 or 3 seconds, and then repeat the correct response and give them the desired action or toy. So this kind of goes back to Mickey's question about frustration with the child. So when you go back and you teach the correct response and then give them the correct response plus the desired item, ideally that will help in reducing that frustration.
And the number of time, you can go as many times as you want back to the joint attention and start again the process. It all depends on the child and how engaged he is or she is and how involved they are and motivated to continue. So you can do it 1 time and then stop and give the correct answer, or you can do it 3 times if the child is still engaged with you and doesn't show any frustration.
Mm-hmm. So this is just a quick example of a modeling procedure, and you can see that the adult is signing more and the child is imitating. And what we want to point out here is that the sign doesn't necessarily have to be perfect. As long as it's an approximation, that's fine. Another quick example, this is a picture that really highlights the importance of joint attention. So you can see that the kiddo is looking at his dad or the person who's working with him, maybe an early intervention provider. And so having that joint attention, the dad's modeling, clapping hands, and the child is imitating this. So these are just a couple of examples to highlight for you. So when we think about the purpose of modeling, how does it help? Why is it important? It really increases the imitation of communication skills in young children, and it motivates the children to imitate you. And then it also prompts the child to communicate.
So I think we talked about 2 strategies so far, and just a reminder to this, we always use environmental arrangement with the other strategies. So if we talk about modeling, think about how you arrange the environment when you use modeling in order to encourage communication. So we thought maybe that's a good time to stop for a second and think about any question that you might have that we can answer right now before we move on to the next.
So please post your questions in the chat box. And Hedda and Jamie, one question that did come in was about culture and kind of family styles. So how do you balance things like environmental arrangement, putting things out of reach, or having missing objects when you give instructions with a family's culture and their style of interacting with their child? So if you could answer that one, that'd be great.
So one thing is to think about what the family values and maybe what activities or settings might be most appropriate for the family. So just being proactive about engaging in activities that might be most useful for them and working in that natural environment. So for example, if families really value dinner time, maybe you could find something that, an activity that's appropriate to engage in during a dinner session, for example.
Yeah, I think we need to remember that not all strategies are good for every family. Each family is its own unit of culture by itself. And I think we need to think about the specific family and see if the strategy really going to be appropriate for them and good for what they are looking for. So always kind of discuss and collaborate and partner with family and see which one is best for them. Most of the studies that are done related to naturalistic.
Oh, we lost you for a second there, Hedda. So I think what Hedda was probably going to say is that a lot of the research in this area, as well as in many other areas, has been done with predominantly middle-class Caucasian families. So I think as interventionists and practitioners, we just always need to be careful and, as Hedda and Jamie just said, communicate with the families and partner with families. And this applies beyond social communication. If we were doing a motor intervention with a child or with the child and family, or talking to them about bedtime routines, being respectful and asking questions about what are they comfortable with and what have they tried and what strategies work for them. And if something you suggest doesn't work, then brainstorming and figuring out what else might you do. All right, Hedda, are you guys back? Maria. If they're not here, I'm not sure if we had a little...
Yeah, can you hear us now?
Yeah, we're fine. Could you hear me?
Yes.
That's okay.
What?
I hope I answered it in the way you were going.
Yeah, we can hear you.
If you want to jump in and add anything else.
No, that's exactly what we were hoping to say, planning to say. We just, there's some sound issue here, but we'll continue and see how it goes. And if people have more questions, please just post them in the chat room and we'll respond to them as soon as we can. Okay, so we talked about 2 strategies, and now we have another question.
So before we move into the next strategy, our next question is, which of the following is an example of a good direction that is likely to increase communication? Is it A, tell me what you want, B, put the ball in the toy box, C, give me a hug, or D, eat your banana?
So again, back to the polling box, 4th box, click your answer, get choices A through D. We'll give folks 15-20 seconds to put their responses in, and we do encourage all of you to put a response in. We'll give folks a few more seconds here to put in their responses. They're still coming in. Okay. Oh, somebody else jumped in. All right. There we go. Let's see what we've got. Looks like we have most everybody pretty much responded with A, with some answers of B as well.
Okay, so tell me what you want. You're correct. It is the best example of giving a direction that is likely to increase communication when working with young children.
Yeah, and just the other ones are also good for communication. Let's just remember, put the ball in the toy box is a good way for us to assess if someone can follow direction. Give me a hug is very communicative, at least in my house, communication of love and affection. But we're talking about more verbal communication. So tell me what you want really require the child to respond in a way with the adult and answer what he wants to the person. So our next strategy is MERN's model. So we talked about environmental arrangement, we talked about modeling, and MERN model is very similar to modeling. But if we talked about modeling, we talked about using new words or teaching or shaping some of the words or the sign the kids uses. With MERN model, we try to do more independent communication with the child. So we're trying to increase the use of developing communication skills through verbal prompting. So it's similar. Again, we're going to use environmental arrangement to arrange the environment to make sure that the child is motivated to communicate. But we're going to use just a little bit different way of prompting the child. We don't just going to model and wait the child to imitate. We're going to use MERN model. And there are 3 different ways we can prompt the child. We can ask a question, what do you want, for example. We can give a choice. Do you want a toy or you want to eat? Or we can give a command or direction, say more, tell me what you want, or something like that. So these are the three different options that we consider as part of the MEND model. And again, we're going to look at the steps that we need to do in order to complete or implement the strategy correctly. We're going to establish joint attention, and again, going back to Mickey's question about culture. Some cultures don't really encourage eye contact between the child and adult, and when we think about joint attention, many people think about making eye contact, but we don't necessarily think about eye contact. Joint attention could be looked or can be done in different ways. We just need to make sure the attention of both the child and the adult are on the same activity. It doesn't have to have a clear or direct eye contact between the adult and the child, even though we know that it's good to have eye contact, but it's not required, and that's kind of going back to the culture. Next, we're going to present demand, and again, we have three choices. We can have give a choice to the child, we can ask a question, or give a direction or a command. We're going to wait 2 to 3 seconds, kind of again individualize the time that we want to wait for the child to respond. But we want to make sure that we stop for a second and give a chance for the child to respond. Working with different families, especially with young kids with autism and developmental disability, and the kids have minimal verbal or have a nonverbal, don't have any communication, observing parent-child interaction, we saw that many times the parents talk a lot, and doesn't stop and give an opportunity for the child to communicate. So what we are working really hard with parents is telling them, use the strategy and then count in your head for 3 seconds. Just pause for a second and wait for the parents, for the child to communicate with you. So we created the opportunity. And then again, if the child responds correctly, we immediately are going to give what the child wants and acknowledge and give positive feedback. If the child doesn't communicate or communicate incorrectly, then we can go back to the joint attention, make sure that the child is still engaged, he's still motivated, he's still with us within the teaching moment, and then we can again do a choice, a question, or a command, and wait for a few seconds. If the child again doesn't communicate, or communicate incorrectly, we can go and stop the interaction, stop the teaching moment, and give the child what he wants and just kind of model what we want. But we can also model for the child and go back to what Jamie talked about. So creating joint attention, then we model. We don't give a choice or ask a question. We model the child in order for him or her to imitate what we want. We wait 2 to 3 seconds and see what happens. If the child is correctly responds, we of course give him what he wants and give immediate feedback. If he or she doesn't imitate, then we have a choice. We can go back to modeling and repeat that again. We can go back and do this again with the joint attention, or we can stop the interaction. It all depends on the child's motivation and involvement. So this is why we call this kind of strategy MEND model, because we start with MEND, and if the MEND doesn't work, then we go back to the modeling. So this is kind of, again, the process of all the steps that needs to be done. There's a question here. Do you support and acknowledge of nonverbal as well as starting point? I'm not sure I completely understand the question. When we talk about, not only talking about verbal communication, we talk about sounds, we talk about signs, anything that show that the child is communicating, and we shape both sign and verbal communication. Mickey mentioned PECs, so again, PECs or any visual strategy can definitely be used with any of these strategies. And using, if we want a choice, we can use 2 pictures to give a choice. We can use PECs or other visual strategy to support with combination of modeling or man model. So if I didn't answer your question, Kathleen, please ask it, kind of ask this in a different way, and we'll try to respond if that's not what you're meaning. So a few examples. Of course, we can see an adult, we can see a child providing a choice. We have the cookie and we have the vanilla. We also can see the environmental arrangement. The child is motivated. She can, I think it's a she or he, can see the items, but he or she cannot reach them. So it's in combination of both environmental arrangement and men. So asking kind of which one do you want. So this is one example. Another example that again points for the joint attention. In this case, we can see the parent or the adult and the child have eye contact, and it's kind of what do you want, or show me what you want, something that will communicate related to, again, choice, a question, or amend. Kind of summarizing MEN model, the idea is to increase use of developing communication. If we talked again, going back to modeling, it was for the child to imitate and shape child communication. Here we want the child to use some of the communication he or she already has and create more independent communication skill. So use known words and signs and help the child use them in the natural environment, and maybe creating more opportunity for spontaneous communication skills.
So now that we've gone through 3 of the strategies, we're going to take another break to do a poll. And so this question is, what is true about giving a child time to initiate communication? You should give the child a lot of extra time before and after you demonstrate the correct response or ask a question. Is it B, after you have already demonstrated the correct response or asked a question? C, before you demonstrate the correct response or ask a question? Or is it D, you should only give a child a lot of extra time if you are trying to teach in completely unfamiliar situations?
This is a confusing question, by the way.
It's kind of tricky.
Polling function. We'll give folks 15-20 seconds to put a response in there. Really got to kind of think about. Maybe we'll give you a few more seconds because it does require you to really kind of process the question and think about the responses that you may have. So give folks a few more. Give your best answer that you think applies the majority of the time, I believe. So folks, a few more seconds here. Answers are slowly coming in.
And we have a hint. It's related to the 4th strategy we're going to discuss.
There's our responses there. Ladies, like kind of most answered A, but it looks like a few of them have chosen B as well. So I'll let you respond to that.
Yeah, so can people change the response if I highlight that? Can you see I highlight the word a lot? So before we talked about waiting 2 to 3 seconds after we model something and waiting for the child to imitate. But now we're talking about 7 seconds or even more. So we're going to give the child a lot of time. So Maria, can people change their questions?
They can. We cleared them out, and they can put in another answer. So we'll get rid of this, and we'll give folks a second chance to answer.
Yeah. So again, we want to wait a lot of time. When would we want to wait a lot of time?
How about that again, folks, using your poll function? Give them a lot. And how long is a lot of time again?
7 seconds.
A long time.
And remember, we're wanting them to initiate communication.
It's like answers are, we'll give folks another couple seconds here to respond. 7 seconds doesn't seem like a lot until you are trying to wait 7 seconds.
Until you have a 2-year-old sitting in front of you, and me, or she needs to sit for 7 seconds without doing anything.
All right, here's your responses. So I'll let you talk through those.
Okay, as we mentioned, we kind of gave a pause before and said this is a tricky question. The answer we were referring to is the before. So we're going to wait a lot of time before we demonstrate the correct response or ask a question, because now we already talk to kids, we use modeling, we use man modeling, they learn new words or new signs, they start using it independently. Now we want them to start initiating. And this is when we wait a long time. And again, for a 2-year-old or 3-year-old waiting for 7 seconds on the carpet next to you without doing anything, it's a long time. So we were referring to C, which means before you demonstrate the correct response or ask a question, because we want to let the child opportunity to initiate a communication. So this kind of leads us to the next one.
Yeah, so this leads us into our last strategy, which focuses on time delay. So time delay is a little bit different. The other 3 strategies focus on responding, but as Hedda just mentioned, time delay focuses on that initiation. Time delay is actually one of my favorite strategies because it gives us an opportunity to let the child initiate communication when you know that they've already mastered some of the previous skills. So if a child has already mastered demanding for, a banana, then you can use time delay when you know that child has that language and give them an opportunity to independently initiate that communication. So time delay is most successful when we use it in familiar routines. So this is really important. During meal times, during bath times, familiar routines in which the child is already familiar. And so the parents or the provider will establish joint attention with the child and then look expectantly at their child and wait for the child to initiate a request or comment. So looking expectantly is a key point here, so the child knows that you are waiting for them to initiate or request. So again, we establish joint attention, we look expectantly, and then we wait 5 to 7 seconds, and this can vary depending on your child. And then, if the child responds correctly, we verbally acknowledge the response and give the desired item or action. However, if he or she responds incorrectly, or if he or she doesn't respond at all, we go back, we establish the joint attention, and then you have 2 choices. You can either model what the child should say or do, or you can present the verbal choice, the question, or the demand. And then if the child has incorrect or no response again, you can repeat the correct response, and then you can give the child the desired item or action. So in this picture we have a little girl in a swing, and so we know that she already knows how to say more. So let's use an example that she can gesture for more or sign for more. So we'll push her 2 times and then stand back and look at the child expectantly and wait for her to sign for more. Again, if you are using a picture communication system and the child has already mastered each of the pictures, he knows what they are, you can wait expectantly for him to choose which activity or which item it is that he would like to do next. So just to reiterate the purpose of time delay, we want to increase the initiation of communication, and we want to teach the child the importance of initiating and not just imitating. It's also very important that we give the child time to process what he or she wants to communicate. So when we think about that window from 5 to 7 seconds and how it might vary, depending on the child that you're working with, you want to make sure that we give them enough time to really process what he or she wants to communicate, because we know when working with children with autism and other developmental disabilities that they may need more time to process. So we want to make sure that we get the child's attention, that we use facial expressions and body language when thinking about time delay. So these are just some general tips for success. And then you really want to make sure that your child is paying attention to you when you're ready to use time delay. So going back to that joint attention. You can place a requested item next to your child or next to your face so that the child can see your face. facial expressions and use an expectant look. And then in combination with environmental arrangement or known words. And then the final point here is to really be patient. Sometimes it takes a while for our kids to be able to initiate communication, but having that patience is a very key component of time delay.
So I want to kind of emphasize that time delay is a little bit different than modeling and man model, because we expect the child to know what to say or what to show or what sign to use. So that's why we're using it within a kind of a known routine, typical routine with the child, going to bed or going on the slide or something like that. Something the child know what to expect and has the communication skills to initiate the communication. So we do look at the child expectantly, so he or she will know we expect them to communicate with us, but we don't use any verbal or specific prompt, and this creates opportunity for initiation. But when we talk about kind of the order of strategy, that's why we talk about first modeling, because you imitate and you shape the child's communication. Then you could go to more independent communication by using question, a choice, or a man, so the child already knows something or approximation of a word or a sign, and then we can shape it through our manding or the three type of men that we have. And then lastly is the time delay, after the child really know the routine and know what words or sign to use. So I think next we're going to have some time for questions. And we had one question. Mary posed a question, and she said some of the parents she's working with really don't like using modeling because it's kind of giving into the child and giving the answer to the child. And again, that's kind of going back to what we talked about with the culture and the specific parent, specific needs and values and beliefs of each parent or family. So we really need to talk about that with the parents when we kind of discuss the strategy we're going to use. But modeling is kind of the first strategy we're going to use, because we want the child to imitate. And some of the kids who are nonverbal or minimally verbal really have trouble with just imitating behavior or verbal communication. So this is an opportunity. But I think I know what you're talking about, because some of the parents we work with, both Jamie and I, and they talk about behavioral principle and more specifically ABA, or strict trial, where you imitate, when you say something and expect the child to imitate again and again and again, and it doesn't look very natural, and some of the parents really don't like that specific strategy. So what we're suggesting is really putting it within the natural environment and make it part of the play, so the child will know what the expectation and will be able to imitate. So we understand what you're saying, and we don't have very specific answer to that. Again, just talking with the parents and explaining to them that that's very basic teaching strategy that provide the child a model that he or she can imitate, and then we can go to MAND or go to time delay where the child could be more independent in his or her communication.
Two questions that came up. Someone else asked about what does MAND stand for, so if you could just spend a second talking about that again, just kind of what the word, where the word comes from. The other question had to do with choices. So in both talking about time delay and man model, you talked about giving the child choices. And I noticed in one of the pictures, it looked like a banana and, in my mind, a brownie. Well, that would be an easy choice for me to pick the brownie. However, if someone gave me a choice of brownie and ice cream, I might have a meltdown if I was two, because I wanted both. So can you talk a little bit about how, especially when working with parents who might initially be starting to use choicing, giving choices to their child, some guidelines or anything they might consider when they're giving their children choices?
So one thing, Nikki, and everyone, is when giving choices, it's important to start out with giving a highly preferred and using a highly preferred and a lesser preferred item. So again, for me, ice cream and a cookie would be a tough decision, but if it's a choice between a brownie and an apple, well, let's not use that. If it's a brownie and a cookie, if someone, like a sugar cookie, if you know that the child doesn't like chocolate, or if you're thinking about activities, you might choose an activity that you know your child prefers. more so than the other. So it might be a little confusing to use two things that are highly preferred when you're first working on manding for those items. So I think it's important to start out with two choices where one is more preferred than the other. Does that make sense?
Yeah, and I will add to that and say that when we teach making choices, it's a skill that we actually need to teach, and there are steps for teaching making choices. And Jamie just mentioned we start with something very highly preferred, something the kid doesn't like, and that's how we start teaching choices. And then when the kids understand the idea of making choices, we can make the choices more related to each other or more similar, so the kids can really make choice based on his needs and his wants. But it is a process that needs to be taught for kids who have some more trouble with that. But Nikki, this was a great example, because if you did that too highly preferred, the kids could be very confused and frustrated with that. The word mend is from, it's very behavioral, from ABA world of talking about mend, so another word for that is direction. Right. So that's the best way to describe that. It's very, very behavioral language. That's why we add the direction, so it will be more kind of known to people.
And thanks, Jamie. You want to keep going then?
Yeah, I'm looking at some of Maria's questions.
Oh, time delay.
Yeah.
So really focusing on time delay. Yeah, using time delay once the child already has that response mastered or has already achieved that is very important. So,
okay, so we talked about the 4 strategies, and again, there are many, many more other strategies, and we can talk about prompting and teaching making choices for another hour. So we're just going to focus on these 4 strategies for today, and we want to move on and talk a little bit about empowering parents. We all know that parents are experts on the children and the families, beliefs, resources, and needs. So it's very, very important that we collaborate with parents. We know that the law requires parents' involvement, but we also have information from a lot of research that shows that if parents are involved, the outcomes for both the parents and the kids are more positive. So it's very important for us, especially in early intervention, when we sometimes see the kids once a week or every other week. We want to make sure that we have opportunity to coach the parents and give them the tools to create more opportunities or learning opportunity for their kids. We know that parents seek access to research-based intervention. There's research about that. Parents really wants to know what's going to work for their child, how they can improve their child behavior or improve their child communication skills. So parents, or most of the parents, are very motivated, but sometimes they don't have the resources or the coaching or the tools to use strategy to improve their kids' communication. We mentioned at the beginning of the session that parents implement intervention are evidence-based strategies, so parents can implement intervention, and we, from our research, we know that parents can use these 4 strategies we just described using the steps we taught them the same steps, and they can use it correctly, and we see changes both in kids and parents. So when parents see changes in their kids, they feel empowered. When parents have the tools and the knowledge and experience, they feel empowered. So we really kind of want to emphasize it. If we give parents more knowledge and more practices they can use in their everyday life, they can really create many more opportunities for the child to practice the new skills, the new words or new signs, and also kind of shape them if we provide. So kind of that's the next phase of our presentation. So we want to ask another quick question. From your experience, please answer yes or no if you have had experience coaching parents.
Okay, you will know
how many of you have
go to the polling function
parents?
And that box is changed to a check mark, which is a yes or no. So we'll give folks a few seconds there to go to the polling function and enter your response in. Getting a few responses here. Okay. Yep, there you go. There you go, ladies.
Yeah, this is so exciting for us that at least half of the people who are in this webinar did some parents coaching, and we really kind of, the research now and also the field in general talk about we need to put more of our knowledge into the hands of the people who work with the kids or be with the kids more frequently, and parents are caregiver are very important. So this is one question, coaching parents. The next question is,
so please answer yes or no if you have had experience coaching parents from a distance. So this one's a little bit different. How many of you have had experience coaching parents from a distance?
Means?
Yeah, good point. Yes. So from a distance might mean you may be using technology, so you might not necessarily be face-to-face in person. You could be delivering services or interventions via Skype, for example, telecommunication, essentially.
So you can use your polling function and respond. This one's probably a little trickier since a lot of providers probably have difficulty with that since EI doesn't necessarily fund that type of approach. So it'll be interesting to see what kind of responses folks are getting.
Yeah.
Okay, I think
I think the biggest challenge now is the billing. Okay, so we have a few people that do use distance coaching or working with parents. Telepractice has become very big in speech language pathologies area. But again, when we talk with people in the field, the billing, especially in Illinois, since it's not approved yet, that's a problem. But we see the field going that direction because working with parents, I want to clarify, we don't think we should stop the direct services with kids and family in the home, but we think, and the field supports that if we use some distance or using the internet to coach parents, it kind of has a few advantages, including saving time of travel to the parents' home, easier to schedule or reschedule if something canceling. The time spent in the home or with the parents is smaller because we don't have to go and talk about other stuff. We just have the time on the computer working with the parents directly about the skills that kids need to develop. So we see that the field's kind of going that direction, so we just want to mention that. I know we don't have too much time, so we go ahead and talk a little bit about our experience with that.
I am kind of curious if folks who are using distance coaching, if they could use their chat box and kind of just give a little comment about how they're using it or what they're doing with that. So,
yeah, that would be great. We would love to learn more because we have some challenges in our project and trying to find best practices related to coaching parents from distance. So any experience you can share with us will be wonderful. We want to just mention adult learning theory and talk about the fact that there's research to support that there are different characteristics of teaching adult new skills, and if you use these kind of characteristics, the outcomes for the adults are better. They understand better and they can practice it with accurately. So these are the kind of just mention them, introduce the information, illustrate or model the information you're doing, have the adult or the other parents or the other service provider practice, give an opportunity to practice, evaluate, so give some feedback to the adult about what they did correctly, they might want to change a little bit, have the adult reflect on their own behavior and their own accuracy of the skills, and mastery where you really do self-evaluation. So these are kind of 6 characteristics of a very effective way of teaching adults new skills. So just kind of keep that in mind. We want to share with you, again, very quickly, a coaching framework that we kind of trying to develop and think about whenever we coach adults. It could be parents, it could be service provider, it could be teacher. There are a few things we want to ask ourselves related to the context. So we just talked about the activities that needs to be done within adult theory and what kind of needs promote learning of adults, but we also need to think about the context in which coaching is provided. So the three questions we need to ask ourselves is, who's providing the strategy, where is the coaching, where it is provided, and how it is provided. And we have few options here. So when we think about who, in the case of the people we're talking about with today, it's practitioner or service provider. So you probably will be the person who's going to coach the parents and kind of use the adult learning theory characteristic in order to make sure the parents can really learn and understand the strategy. Where there's two different options that we can think about where to teach. We can teach in authentic setting, which will be a home or preschool setting, or it could be a controlled setting, which is a clinic, for example. So these are the two options. So every time you think about coaching, you need to think about where I'm going to do that. It's something you kind of intentionally need to think about because there's different advantages and disadvantages for each one of these options. The last question we want to ask ourselves is how are we going to do that? We can do coaching individually with parents or with service provider or teacher, or we can do it in a group. So this is one thing we need to think about. We also need to think about the thing that we just discussed a few minutes ago. If we want to do it in person, which means going to the home and work with the parents directly, or going to the preschool and work with the teacher, or we want to do it from distance using some internet technology. So this is part of the framework, and there's some advantages and disadvantages for each one of the choices here, and this is some of the research we are currently conducting. So again, if you have any ideas or experiences, please share those with us so we can kind of think about the next step and how to make it more accessible to everyone. So I think that's all we have about the framework at this point.
So we also just wanted to share very quickly a few resources. So it might be a little hard to read, but we have here a few resources that might be useful for you in terms of thinking about evidence-based practices for young children with communication delays. And so there's the Affirm website at Frank Porter Graham and UNC, and they have a number of different modules that might be helpful for learning about strategies. There's Autism Speak, Pan Speak. So these are all some resources we used in some work that we published not long ago that might be useful for helping you to think more about each of the strategies, and then giving you some examples of how to implement those strategies both with young children and with their parents.
This is from an article we published, and we'll be happy to share that if anyone wants to be able to read what's on the screen. There are a few questions here related to the distance education. So Affirm is the one, it used to be AIM. They have very wonderful modules that service provider, teacher, we use it with our students, and parents can learn about the different strategy, including the strategy we talked about. And they're all evidence-based strategies. So in addition to how to do that, you have the research kind of background for each one of them. There's a question here about the use of distance kind of coaching, and if parents like it or not. We have experience with quite a few families so far. There's some advantages and disadvantages, as I said. I think one of the biggest advantages the parents mentioned is that they don't have to clean the whole house. They can clean just the area that you're going to see through the camera from the computer. So, but parents like that because it's short, they don't need to do too many things, and they get the same information. Of course, one of the disadvantages is that we need to train or coach parents on how to use technology. In some area, the technology or the internet connection is not very good. So this is something else we need to consider which family will be best for that. But overall, there's positive kind of feedback on the use of technology here. So I wonder if there are any other questions before we turn it back to Maria.
So Elaine is making a comment too about cancellation. So you want to talk about that, Hedda or Jamie?
Yeah. Yeah, when we developed a regional program, I used to go into the homes 4 times a week and kind of coach the parents. And a few times I drove, which was an hour away, one of the family, and I came and they forgot, or the kids was sick, and it's so much easier when we do it over texting, and they said, well, I need 10 more minutes, or can we just reschedule for tomorrow? Cancellation are much easier to do when we do stuff via texting or emails, and feedback could be immediate when we talk via video conferencing, but also could be done via email after that. So there are quite a few advantages of using long-distance coaching. Can we get another copy of the resources? Yes, of course. We'll send it to Maria with maybe a better
yeah, so maybe Alyssa could upload it or whoever as a separate page by itself rather than part of the PowerPoint. Might read better. All right. This is great, you two. Yes. Wonderful information. I'll turn it back over to Maria to kind of close people out and let them know how to access certificates and things. Oh, Alyssa's already posted the link. Thanks, Alyssa.
I did want to say that with the coaching in the distance coaching, that I know for older children and families that have embraced technology, that it seems to work really well. For families who are still hesitant or unsure, that sometimes that makes it a little bit more difficult. But with our world as it is, I mean, even today, we're doing distance coaching through training today, through a webinar process. In healthcare, you're seeing more distance healthcare services through Skype and online, and so it'll be interesting to see where our systems go with this for younger children and families. Thank you guys so much for your webinar today. It was full of much useful information. And as folks know, Alyssa has put the website back on there again for that resource page. If you weren't aware, in your reminder handout, reminder email that you got, there was a resources page that you could download, as well as the PowerPoint was downloadable as well. If you do want to reach either one of these ladies in person, this is their email, and it is on the PowerPoint that you were able to download. As another reminder, I do want to remind you that you will be getting a unique email, and to be looking for the EI Training Program email. If you didn't register on your own, you would have had to have, in order to get this email. Complete the survey that's in the email. You'll get your certificate within 24 hours. And if you do have any problems or any questions about that, please email eitraining@illinois.edu for any assistance with that. With that being said, I think we are done with our webinar for today. Thank you so much, ladies. We do hope that we will see folks again next week. I think our webinar next week begins at 1:30, and unfortunately the topic is escaping me at the moment, but I know it'll be good. So I think we have a professor from University of Massachusetts in Boston.
I'll tell you, I can tell you right now, Maria, it's called Strategies to Implement Family-Centered Practice in Early Intervention. So it actually will be a nice complement, I think, to how Hedda and Jamie ended this one, talking about collaborating with families. So that's Angel Fettig doing that one next week.
Great. Thank you so much. All right. With that being said, I think I'm done, unless you ladies have anything else you want to share.
No, thank you very much, and please contact us if you have any question, ideas, or experience you can share with us about future projects. And yeah,
thank you so much.
All right. With that being said, our webinar is completed. Thank you so much.
Thank you.